If, like me, you are living with arthritis or indeed any other chronic health condition that relates to inflammation, it's important that you learn how to self-manage the condition. So you will be working with a doctor or maybe a rheumatologist or some specialist for whatever your condition is. But as I've said in many other videos that I've recorded, you can't just hand your health problems off to a doctor, okay? There's a self-management component. You are responsible for your own health. So today we are going to talk about how to start thinking about self-managing your condition. And we are going to do that by using a technique or a way of thinking called systems thinking. So let's just jump straight in. We're not going for a walk today. Usually we go for a nice scenic walk for these videos. But today I've got a bunch of diagrams to make this process easier. So let's just jump right in. So in this diagram, we have two concepts that are important to understand. The first is a stock and the second is a flow. So the box in the middle there with inflammation written on it, that is our stock. In systems thinking or system dynamics, whenever you're trying to think about something that you can measure or quantify, you're usually talking about a stock, okay? And for us, if you're living with an inflammatory condition, the stock that you might be interested in is the level of inflammation in your body, because ideally we want to keep that level pretty low. Now, also in the diagram, we've got an arrow feeding into that and an arrow feeding out. So whenever you've got a stock, something that you can measure, something you can quantify, usually there is something that causes the stock to rise and there's something that causes the stock to reduce. So a stock could, for example, be your bank balance, right? And getting paid increases the money in your bank account, and spending money, buying food, whatever it is, decreases. Okay, so the arrow going in, we're talking about factors that increase the value of the stock, and the arrow going out, we're talking about values that decrease that value. Okay, now on this diagram, each of those arrows has a tap. And the reason I put a tap in there, and this is pretty standard again in system dynamics way to think about this, we are going to be looking at things that turn that tap one way or another. So in our case for information, we're going to be thinking about what are the things that we do that cause the tap on the left that makes our inflammation increase? What opens that tap versus what closes that tap? So when we think about inflammation, usually we are thinking about acute inflammation. And inflammation isn't a bad thing. I've talked about this in previous videos. Your body needs inflammation to fight infections or heal from injuries and all that sort of stuff. So in our example now, we have an infection in the diagram, and that infection, what it's doing is opening the tap, right? So when your body detects that there's an infection, inflammation starts to happen, right? Your body's going through all of these sorts of chemical processes. We're not going to get into the nitty gritty, dirty scientific details here, but basically body detects an infection, all these processes start to happen. The net result is inflammation is increasing in your body. So we're opening that tap, okay? Now, on the outflow from our stock, I've got it labeled as something called SPMs. Now, we don't need to worry too much about this right now. That SPM stands for Specialized Pro-Resolving Mediators. So basically, this is a part of your body that once the inflammation process kicks off and the inflammatory process has done its job, so fought off an infection, or maybe there's a wound on your skin or something, and it's fighting against bacteria that may be getting into your body. SPMs are something that help resolve that process, right? So help bring the inflammation down. So we have this balance here where you've got a process that kicks off, he raises our stock, in this case inflammation, and then we have balancing processes that lower that stock again. Now, we're not going to focus too much today on the lowering side of things, which we're actually more interested in what is raising your inflammation. But when we think about acute inflammation like this, so again, you're getting sick, you've got a wound, you've got infected with something, usually we're going to take some sort of medication. So on the diagram, I've added NSAIDs here, which is a non-steroidal anti-inflammatory drug. So ibuprofen is a common example of this. And interestingly, you might have intuitively thought that an NSAID would be on the other side of the diagram, that actually it's reducing inflammation. But what an NSAID is actually doing is stopping the inflammation process, right? It is stopping the creation of more inflammation. So if you get an infection or something, or let's say you've got an injury to your hand and it's getting red and sore and inflamed, you might take some of these anti-inflammatory drugs, and what will happen is it stops more inflammation happening, and meanwhile your normal bodily processes are kind of dealing with the inflammation that's happening there. So when we're looking at the tap again, it's important to think about we've got the things that open the tap and are increasing the inflammation in our body, and we've got things that are closing the tap, right, which is reducing the flow into the inflammation. Now, there can be a delay there as well, right? So the infection can open that tap, and you might take one of these tablets, and then the tablet might take whatever, half an hour to start being effective. So we've actually got a delay here. It's not like the infection opens the tap and you swallow a tablet and straight away it closes the tap, right? There can be a delay and it takes a while for that tap to close. So inflammation can be increasing during that time. So I want to move away from acute inflammation and talk about chronic inflammation, because if you're living with arthritis, it's actually chronic inflammation. That is a kind of constant low-grade inflammation that you've got going on in your body at all times. And that's where the real problem is. Like I said, acute is a normal part of how your body functions. We need it, to fight infection and all that good stuff that inflammation does for us. But for whatever reason, if you've got an autoimmune condition like psoriatic arthritis, you need to think about chronic inflammation and what you can do to reduce the amount of inflammation on your body so that you're not constantly undergoing this inflammation process, because it causes a host of problems in your body. For example, it can attack your joints, as in the case of arthritis. It can increase your risk of cancer, increase your risk of heart disease. And that is because you've got this inflammatory condition going on throughout your body. You've got these immune cells that might actually be attacking healthy cells like your joints in the case of arthritis. So chronic inflammation is what we're interested in. So looking at our diagram again, I've added in another element here. And this arrow pointing to the tap is about movement. So we know, I can say anecdotally, but we also know through plenty of scientific study, that movement, I mean walking, jogging, lifting weights, whatever it is, swimming, some sort of exercise, is actually good for reducing inflammation in the body. So movement is turning the tap the other way, right? So let's say if we ignore our infection and NSAIDs for the minute, we've got a general level of inflammation because we're dealing with chronic inflammation. Movement will help reduce the inflammation. So movement will close that tap, okay? So when we're talking about self-managing a condition, we've got drugs and we've got those sorts of interventions, and that's fine. But we've also got these kind of non-pharmacological interventions that we need to think about, because they can be incredibly effective when applied consistently, okay? So we've got movement, and movement is closing the tap. But there's something really interesting about thinking of systems in this way, okay? So we've got our stock, we've got flows in and out, but the state of our stock can actually influence the flow itself. And this is important because if we look at the diagram now, you can see we've got an arrow going from our stock of inflammation to the tap, which if you follow back to the stock, then just goes in a loop, right? So we've got a cycle here. And what this is representing is, as you move, the tap is closing, your inflammation is going down, which makes it easier to move. So you can move more, which closes the tap more, which reduces your inflammation more. So you've actually got this positive reinforcing cycle. Now, I chose to go with the positive example first, but the opposite is true as well. If you've got a lot of inflammation in your body at any given moment, so let's say I'm having a flare up, right, and my hip is particularly sore, I might not want to move, right, because it's uncomfortable to move, I'm in pain. So my inflammation has gone up, my willingness to move has gone down, and now moving less means more inflammation. So actually not moving is opening the tap a little bit. That's increasing my inflammation. That is, again, reducing my willingness or ability to move, which again is opening the tap more and increasing our stock of inflammation. So you can see how this can quickly spiral and become problematic. The worse our inflammation gets, the less we want to move, and the less we move, the worse our inflammation gets. So it's important to be really cognizant of this fact, is that by not taking action, you can be affecting your ability to take action, which is making things worse and making it even harder to take action, right? And this is why when it comes to self-managing a condition like arthritis, and again, this can be applied, I think, to any chronic health condition, thinking about it in terms of systems and system dynamics like this is really, really useful, because you can start to expose these sorts of connections that maybe you don't naturally think about in your head when you're thinking about your condition. So I want to throw in another element here, which is stress. So we know that stress can increase inflammation in your body. So now we've got stress opening our tap a little bit, movement, if we're moving, going for a walk, swimming, whatever, closes our tap a little bit and it's reducing our inflammation. But we've got another interesting link here. okay? So movement, we know, can reduce stress. For example, going for a walk in nature. In Japanese, they call it, or in Japan, they call it forest bathing, right? And I think therapists have even been known to prescribe this to people that are, stressed and depressed and whatever else. They'll say just go and be among the trees, be in nature. I do this all the time. It's really interesting. I find that I go out into the woods and I walk around and a weight is just kind of lifted off me. And then I come home and I get back into traffic and kind of the grey urban concrete setting. And I almost feel that weight coming back onto me. But when we think in terms of our system, right, the more we move, the less stressed we are, right? So we're exercising, we're reducing stress, which is then closing our tap a little bit, which can help reduce the inflammation, which allows us to move more and de-stress more. So again, we're building on this. Now, if we're stressed, that can increase our inflammation, which can reduce our ability to move, which can increase our stress. So you see, we're starting to building these kind of parallel reinforcing feedback loops where if we're not, you can go out and be doing all of the exercise in the world, but actually if you've got like some really stressful component to your life, maybe that's the thing you want to address, okay? And all of these things work together in tandem. So if you're really stressed and really inflamed so you can't move, well, maybe actually you can take an anti-inflammatory tablet, one of these NSAIDs, and maybe that can reduce your inflammation enough so that you can move, and that can de-stress, and that can kick off this like chain reaction of positive events and a kind of this positive feedback loop. So again, as we start to expand, and what we're really doing here is we're building a mental model of our condition. We're trying to understand what are the things that influence our condition and where are the leverage points. And that's really, really critical. We want to understand what are the things that we can do and change that really provide leverage for us, okay, where we see the kind of biggest bang for our buck, right? So I'm going to add a couple of more things in here. We know that smoking will open our tap. There is literally no upside to smoking. And this is coming from someone who, if you get a few drinks in me, you might even find a cigarette in my hand to this day. I started smoking very young. I smoked for many years. It's a horrible addiction. Definitely wouldn't recommend it. But we know smoking will open the tap, right? We know ultra-processed food will open the tap. That will increase our inflammation. So when I'm talking about ultra-processed food, I'm talking about sugary drinks, right? Sports drinks, anything that's kind of in packaging that can sit on a shelf for 6 months and still be okay to eat. These sorts of highly processed foods, we know they're connected to inflammation. Conversely, you'll notice I've added something on the other side. So omega-3 fatty acids. We often talk about the benefits of omega-3s like fish oils and stuff like that. Part of the reason why they can help with inflammation is that they actually help with the SPM process, which can help our body's ability to kind of recover, right, and remove the, let's say, inflammatory particles from our blood and from our body. So what we're putting into our body can have a big impact, actually, on both sides of our stock here. But let's go back to the ultra-processed food. So this is an interesting one because ultra-processed food is also linked to increase in body weight, okay? Now, if you're eating a lot of ultra-processed food, you're not necessarily overweight, but the chances increase that you will be because these are very calorically dense foods that are very easy to overeat. There's very little fiber in a lot of these foods, so you often don't feel full, right? And they're filled with sugar, which you can eat a lot of sugar. So like if you can drink a half-liter bottle of Coke, right, pretty easily, but then you've got a couple of 100 calories and you're not full. You're more hungry, if anything. And if you're eating this processed food, that can open the tap a bit, but it can also increase your body weight, and having excess body fat can also increase inflammation. So now through the ultra-processed food intake, you're opening the tap, you're contributing to a certain body composition that's opening the tap even more. So when I talked about leverage points previously, that seems like a prime leverage point to target, okay? So getting these sorts of processed food out of your body, or out of your diet, can really, really contribute to reducing the levels of inflammation. And laying all this stuff out in a diagram like this, and I'd encourage you even to draw your own diagram that's more representative of your life. You can kind of get a sense of all the connection points, because when we're thinking about systems, none of this stuff is static. I talked about it in the previous video. everything is a system. We're built of systems, and everything's dynamic, and it's constantly moving and interacting, and different things are affecting other things. So here we've got our food intake is affecting our body weight, and again, obesity is promotes inflammation. It's to do with chemicals being released by your body fat that trigger inflammatory processes. I'm not going to get too deep on the science and technical stuff in this video anyway. We'll probably go a bit deeper in the future. But we can also go one step further here. I think this is going to be the final step we're going to take today. We're going to expand on this mental model in the future. But for today, we're going to stop here because it's very easy to go down a rabbit hole, and we'll have a hugely complicated, giant diagram to go through. But our excess in body fat can also impact our ability to move. And as we talked about earlier, not being able to move can open the tap more. It can increase stress. So now all these things are compounding. So again, when we talk about leverage points, that ultra processed food seems like a really, really significant leverage point that we want to target when we're self-managing a chronic health condition like arthritis, psoriatic, rheumatoid, any sort of inflammatory condition. That is a great leverage point to think about. So that's basically all I wanted to talk about in this video. I think, like I said before, system dynamics is a really useful way to look at self-managing a condition like this, because when you lay it all out like this, you start to see connections that maybe you weren't aware were there before. You can start to see how you can quickly spiral. Things can spiral out of control as the inflammation can affect various other things that in turn end up increasing the inflammation, like we talked about the reinforcing loop with movements. So have a think about, well, I'd say have a think about this diagram. Is any of this familiar? Do you know yourself that when you eat in a certain way, maybe you feel more inflamed the next day? I know that I do. Maybe you're smoking and you need, some motivation to quit. Hopefully thinking about it like this can help. Also thinking about things like NSAIDs, right? In the future, we'll probably there'll be a line going from NSAIDs out to a whole other diagram, which will talk about the side effects, which is why you can't just take them all the time. You can't just take NSAIDs every day, or you'll end up with maybe ulcers and bleeding in your stomach, which you really, really don't want. So there's a lot of kind of complications and things we can expand on here. But for me, this is the foundation right here of self-managing your arthritis and beginning to think about how to self-manage a condition like this. What I think would be a good idea at this point is, you don't have to put it in the comment, but I think it'd be great to write it down. But have a think about the next week. Have a think about this diagram, and have a think about something that you can do that maybe would create a bit of leverage. Maybe it's reducing the amount of processed food you eat. Maybe it's increasing the amount of vegetables you're eating, right? One of the problems with ultra-processed food is the lack of fiber. So maybe you can increase your fiber, and even just do it for one meal over the next week. Maybe over the next week you can go for a walk one day. And if you are going to do this, what I'd like you to do is be specific. So say on Tuesday, I'm going to go for a walk for 15 minutes at 7 p.m. Okay? Just write that down, make that your plan for the week. And then the next time I post a video, we can come back and we can check, did you actually do that? If not, why not? And we can try and problem solve and figure that out. But I think it's useful to start thinking about, well, what are small actions I can take that will start closing the tap and helping build these positive reinforcing loops rather than the negative reinforcing loops. Anyway, that's all I've got for today. If you found it useful, please like the video. Like I said, I'm going to dig in. We're going to expand on this. I'm going to do a bunch more videos that talk about specific tips on how to, let's say, look at changing your diet or increasing the amount you're moving, all that sort of stuff. So if you're interested in that, go ahead and subscribe. Hit the notification bell and you'll be notified when those videos are live. And yeah, other than that, thank you for watching and have a great day.